The first speaker here today, the first panelist, is Dr. Mallory Honan, who is a livestock methane scientist at the Environmental Defense Fund, where she focuses on reducing methane emissions from livestock by advancing scientifically grounded real-world solutions. By collaborating with farmers, technical experts, and decision makers, she helps ensure that climate-smart practices in animal agriculture are both effective and feasible to implement. Please join me in welcoming her.
Thank you so much for the introduction, Dr. Mitlerner. It's a pleasure to be here with you all afternoon. A lot of great minds in the room. It's been a very thought-provoking session, so I'm happy to continue that on in the feed additives because they have been mentioned throughout the session so far. As Dr. Mitlerner mentioned, my name is Mallory Honan, and I'm a livestock scientist at Environmental Defense Fund. And since I'm here at my alma mater, all the cow pictures in here are UC Davis cows and steers. If you are familiar with Environmental Defense Fund work, it's no surprise that we've expanded into livestock science. And with livestock science, we have enteric fermentation as a leading contributor to methane in the United States. And we have talked a bit about, on the global scale as well, on how the emission profile can look different from country to country, which depends a lot on livestock population, as well as the developing nature of the country. Here we have Brazil, India, United States, China, and Russia with that dark bottom bar representing enteric methane. And you can see the profile changes, and we've had the opportunity to see even other countries' emissions profiles throughout the day. And while they change, methane remains one of the low-hanging fruits and a major opportunity to make acceleration on reducing climate change. We've talked about vaccinations, genetics, improving animal productivity and health as ways to reduce methane emissions, and now we're on to feed additives, which is a very umbrella term for ingredients that are fed to animals that either directly inhibit the methanogens in the rumen or they shift rumen fermentation pathways to the point of reducing methane production. And while it's just one promising strategy, this is one amongst many, and the effectiveness of this strategy can range to a mild 5 to 10%, which is still important, to over 75% in reductions. So feed additives really vary on the whatever one you are talking about. In the sake of time, I'm only going to talk about the US context, but right now we only have permission from the FDA to use one product known as Bovaer or 3-NOP to be marketed for intended use, and that's a really important point, that intended use of environmental claims and reducing methane. And you might not know this, but it is only approved for lactating dairy cattle, so beef producers do not have this as an option currently. There are, however, a handful of other ingredients that are in the market for other reasons, and they have, based on evidence of small early trials or assumptions, have piggybacked some environmental claims, which have merit, but can also be problematic in the space when we talk about regulatory, and I'll get into that. But we've made great progress in the space. We're identifying that enteric methane can be tackled with feed additives, and we are starting to identify these solutions. However, there's a number of barriers that are really preventing this from being adopted by the industry. I really summarize them into 3 major points of being gaps in research, not just gaps in the research questions, but the gaps in how solution providers are approaching research, uncertainty in regulatory pathways, and a lack of an ecosystem for producer adoption. In terms of gaps of research, I could really make a really exhaustive list here, but I tried to summarize it. Like I said, there's gaps in research questions, and it's perfect that we just came after the measurement in methane, because as you've heard, methane is extremely variable. So having robust evidence of effectiveness is so incredibly important because methane will differ from every single farm you go to. A lot of these, there are additives who have one study, have a great reduction, and all of a sudden that's their emissions reduction factor, and that's just not accurate or quality research. So when we're approaching these questions, we also have animal health and welfare. The word safe is being thrown around a lot with a lot of strategies, and it's really hard for us, well, it gives me pause as a scientist to hear the word safe when we don't know the rumen dynamics that are occurring after we implement these strategies. We really need to be looking at the animal health and what does safe mean? What are the parameters that you're looking at? And these are defined by the FDA and pathways, but I fear that gets lost in what we're considering safe for the animals and for ourselves as well. I could keep talking more about them, but I won't. But it said proper funding for research is so important. I think people underscore, or underestimate, I should say, how much money it takes to run these research projects, high quality, following best practices for scientific research having enough replicates for the study question that you have in mind, good laboratory and clinical practice, and that might mean you do your research at a commercial research organization rather than a university, because understandably, every lab is not fit to run GLP. That doesn't mean the science isn't good, it just means the interpretation can be different, and it's not FDA level necessarily. Peer review is very high quality, we have it reviewed, but it's not necessarily the data that's going to get food into our system and that is safe for consumers and the animal. In terms of regulatory, I'm using this bullseye figure to emphasize that in the center, having FDA permission and hopefully approval when we have a pathway in place will be the way to go, because not only does it rigorously assess safety, but also the effectiveness of the product. We want farmers to be feeding something and they know that the reduction is going to happen is actually what is being marketed as. Under that, or the next ring out, I have AFCO. This is no longer a pathway that can be pursued. They have similar safety regulations to the FDA, but they did not have a developed framework for methane reduction, so if the additive was claiming effectiveness, it wasn't necessarily verified. The outer ring I have generally recognized as safe, which can be a company-claimed label, and I would just proceed with caution there. For key qualities of strategies and products, I say these main 4 items. Number 1, effective at reducing methane without environmental trade-offs. If it creates so much carbon and methane in producing the product, there's really no point to introduce it into the system. Safe for humans and animals, widely adopted by the industry, and accepted by consumers. I'd say the majority of strategies, at least in the feed additive space, that's what I can speak to the most, are in this section. Still doing proof of concept research. You need to be doing research with your specific product, and you can only lean on literature so much if you're claiming your product has identifying and unique characteristics. You need to be running robust research on your specific product. So I'd say majority are in here. We have some products that could be widely adopted by the industry, but we don't want to surpass safety for humans and animals, as well as the effectiveness. And right now, I would say we're at here for 3 NOP. We've gone through the yes, safe, yes, effective, but we're not yet widely adopted by the industry. And so how can we improve producer adoption? Oops, backwards. So EDF support in reducing enteric methane to address the gaps in research, as well as uncertainty in regulatory pathways, and then improving the producer landscape. We're doing work in enteric methane quantification with Cornell and Dr. McFadden on scrutinizing and validating enteric methane approaches. We are working with policy on the Emit Less Act and the Innovative Feed Act to try and establish those regulatory pathways with the FDA. Working on incorporating or creating a framework for these methane-reducing feed additives to be incorporated into pre-existing nutrition formulation programs so nutritionists and farmers can use them in their diet. And also, we are part of the Dairy Methane Action Alliance, which is an alliance of dairy sourcing companies to disclose their methane emissions and create an action plan and strategies for their producers to reduce their emissions and not place the burden slowly on the producer. Essentially, all the work that we do at EDF is to support people from behind the scenes and providing technical and scientific expertise and making sure that the solutions that we're pushing to come online have scientific evidence and are safe for consumers and animals. Thank you so much for your time.